equally as bad effects of lockdown seen in New Zealand.
Yeah, well, so New Zealand, of course, has been a country that, like us, has suppressed coronavirus to virtually nil. But guess what happens? Well, when you try and suppress one respiratory virus, you suppress all of them, including a lot of ones that are a lot less dangerous. Now, what does that mean? Well, that means that normal people, from infants to the elderly, then aren't necessarily all the time fighting off things with their immune systems, and therefore their immune systems, like muscles that don't get used because they're not exercised, become incredibly weak. And now we are seeing huge spikes in very deadly respiratory viruses that normally we don't see much at all in the community. 46 cases right now in New Zealand, including infants who are on oxygen, of something called RSV, which we normally don't see. We are going to see huge health flow-on effects, I think, from the fact that we have now basically weakened all of our immune systems with the fanatical masking, with the fanatical social distancing, with everything else that goes along with this. You know, it's the same thing with little kids who aren't allowed to play in the dirt and they wind up developing allergies and things like that. We are doing this society-wide. But the other day, Kerry Chant, the New South Wales Chief Health Officer, Chief Health Bureaucrat, said our sole focus, she said, our sole focus is fighting COVID. Well, you know what? When you do that, you have this tunnel vision, and we are going to see the flow-on effects from this, not just in health, not just in mental health, economics, everywhere, all because of this one thing. And, you know, I would love it if we could have a broader conversation about risk and life and death and society, which we are unable to right now because we have become so tunnel vision focused on this, we can't deal with anything else. And the flow on from this is going to be tragedy for years.
Well, it is, James. And the Helsinki Declaration, which is what the Hippocratic Oath is based on, very clearly states, I think it's point 8, that all medical intervention, doesn't matter what it is, all medical intervention is a balance of risk and benefit, as you were just saying. And that is the reason why informed consent lies at the heart of the West's medical approach. Informed consent means that the patient and the doctor weigh up the risk versus the benefit, because for every individual it is different.